Hi, this is Dr. Walker. Welcome back to the channel, danwalker.com. So I want to give a little discussion or rediscussion about something we've talked about in the past, which was really talking about a couple of things. One is zinc, and the other one is vitamin C. So I had an acquaintance of mine this past week, and he had been feeling sort of unwell for the last several weeks. And I saw him, and I just wanted to know what was happening with him. You know, he's been had the jab, and recently had just been feeling kind of unwell, and his tests have been negative for any viral sort of infection, and just kind of want to know what they had him on. And he explained they gave him some zinc, and they gave him vitamin C. And well, I'm happy they gave him zinc and vitamin C. I really am. But when you're taking care of a viral sort of infection, you need to have the whole package for these supplements, or else they don't work as well as they should. Now, his vitamin D levels was 7 nanograms per milliliter. And for you, if you don't know, that's very, very, very low. So they gave him 20,000 units to be taken for 3 days and then stop. And so the part about that, which I did not like at all, was the fact that they stopped it in 3 days, one, and two, there was no plan to recheck the vitamin D level, D3 levels. No plans for that. So he had 3 days, and that was it. And again, his levels were 7 nanograms per milliliter. And as you know, I'd rather people, especially in the wintertime, those vitamin D3 levels should be upwards about 80 to 100 nanograms per milliliter. That's sort of my suggestion to folks, because vitamin D is a hormone, and sort of you use it once you become ill or unwell for whatever reason, it uses vitamin D. Vitamin D has multiple receptors all over the body, in the heart, and in the lung, and the colon, just lots of places and so forth. So when you're using it, or you're unwell, you're using it up, and so you need to have a standard dose that you're taking sort of daily to kind of keep your levels where they need to be. And so again, those levels being that low, in my mind, there should have been sort of a regimen that person should be on. That's the first thing. Then the other thing that he was doing was he's taking his vitamin D supplements just by itself with some water. And again, vitamin D is a fat soluble vitamin. And what that means is that you need a tiny bit of fat for it to be absorbed well. And so for me, I've been saying you can try things like almonds or avocados, a little olive oil, a bit of olive oil, coconut oil, any of those things that are fat, good fat based, can help the absorption of vitamin D. But I also said recently that you could take as much vitamin D as you want, and you take with all the fat soluble things that you're eating. Its benefit, though, and the absorption still depends somewhat on your magnesium levels. So magnesium is also an important element to have when you're taking vitamin D3. And for men, that's about 400 milligrams per day, and for women, it's a little bit less, like 320 milligrams per day. So those things should work in concert, right? So you get vitamin D3 with a bit of fat, like avocado, and also magnesium. And also magnesium helps you with sleeping as well. I think I mentioned that before in several videos in the past. So that's the first part. The second part to that was zinc. Zinc is another, I'm sorry, I probably didn't mention that. Zinc was another thing that they gave him. So zinc is an extracellular element as well, right? So taking zinc by itself is great if you're eating lots of things like apples and onions and red wine and those things. But again, you need a lot of those things to help to mobilize zinc from being an extracellular element to an intracellular element, which means zinc does its function when it's inside the cell, not when it's outside the cell. So you need a method to transport that zinc from being an extracellular element to an intracellular element. So you need an ionophore. The one I've been talking about for a while now is quercetin. So my suggestion to him was not just to be taking your zinc, but you also need to take an ionophore, some way of transporting that zinc from where it is to where it needs to be. And those things, and again, you can eat, you can be an avid onion eater, but you probably will not get enough ionophore that you would in a capsule of quercetin to help that zinc going from being an outside the cell source to an inside the cell source. And again, zinc works, it can be sort of a lethal process when it comes to viruses, right? But it has to be in spot to decrease the viral replication again, which is an intracellular process. You have to have that zinc inside the cell again to help with that. So I sort of mentioned that as well. So the first thing again was vitamin D3 with a little bit of fat, and that vitamin D3 also needs magnesium to help it get to do its job. And the other one, again, is zinc. Zinc, again, needs an ionophore. And, other things can be that, can do that job. Hydroxychloroquine, for example, is a great ionophore, and ivermectin as well is a great ionophore. But for the most part, you can get quercetin from Amazon or wherever else online for help. And the last one was vitamin C. Now, vitamin C is great, right? Vitamin C helps to boost the immune system. It helps to sort of increase your white cells, specifically lymphocytes, which again help the immune system. It's great, right? And a lot of folks take a gram of vitamin C per day, and that works well. I take 2, as many of you know. Vitamin C can cause some GI upset, and so that's usually the limiting factor. So in other words, people who've taken too much vitamin C can have a little bit of a GI belly issue, diarrhea specifically, and that sort of tells you that you're taking a little bit too much. But the other thing that's great about vitamin C is vitamin C helps the quercetin to do its job, right? So quercetin by itself is not very bioavailable. So in other words, it's not well absorbed by your system. So things that help quercetin increase its absorption would be to take it with a little bit of water, or by itself. Again, by itself with a little bit of water, or you can take it with things like vitamin C. And bromelain is another thing that sort of helps the absorption of vitamin C. But again, vitamin C is going to help the quercetin get into where it needs to be for it to be functional. So those are kind of surprising to me that they didn't sort of mention all those things to them. So yeah, you have elements and supplements, but you also need to understand what works well with those things. Finally, the zinc I mentioned before. So you have zinc, zinc gluconate, zinc citrate, a lot of zinc types out there. There is the issue that is surrounding zinc sometimes is that it can also cause some belly or GI problems. So I've been telling folks, if you try one version, citrate, gluconate, orotate, if you try one and it doesn't work for you in that it causes you some significant belly problems, then try another one. It's typically combined with one of those things again to help the zinc get absorbed. By itself, it doesn't get absorbed very well. So it's added to a chelator, whether it be, again, one of those things, citrate or one of those. It's a chelator, and the chelating agent helps it get absorbed. And sometimes you can actually have problems with just the chelator itself and not necessarily the zinc. So try one of those, a different chelator if it causes you a problem. If that's still, you tried 4 or 5 different types of zinc and it's still causing you an issue, then what you can do is take it with food. And in fact, that's my suggestion from the beginning. Take it with food. And if you take it with food, you can either take it in the middle of your meal. So in other words, eat half your meal and then take your zinc, or you can wait until you're almost done with your meal and then you can take the zinc. One of those 3 is going to help you. Either try a different chelating form of it, eat half your meal and then take it, or eat it, take it towards the end of your meal. One of those 3 should help you with the belly issue. Anyway, and I think, colds, flus, whatever colds or flu, or anything else that happens in the wintertime, those things that I mentioned a second ago can all help you stay well in the winter. Thanks for listening, Dr. Walker.